think one of the key things, and we all can attest to this when we're talking about making some of those lifestyle changes and being aware of our behaviors that we have, and portion size is one of them. Give us an idea of the portion size of meat, because I think that usually tends to surprise people that it's not the steak that they think they're supposed to get either at the restaurant or buy in the grocery store to grill out. What's a normal serving size for our meat?
A normal serving size is going to be about 3 to 4 ounces. So again,
which is usually
about a quarter of your plate, about the size of the palm of your hand. A deck of cards is what it's comparable to. But you know, just like I was saying, you know, if you have half our plate should be fruit and vegetables, but it's very common to have half our plate in the form of meat, especially if we go out to a restaurant and we're served 8, 10, 12, 16 ounces of meat on a platter. And those, you know, you're looking at, depending on the kind of meat that you're choosing, anywhere from 35 to 100 calories an ounce. So you do the math, you have a 10-ounce steak at 100 calories, you know, you have 1,000 calories just in your meat. So cutting the portions back, you can still have the steak, but definitely going to take in a lot less calories just by looking at portion size.
So Dr. Dowe, I know we've been talking about, you know, the calories that we need to have in and actually burning them off too. And I had some information that 3,500 calories kind of equal a pound of fat. We've heard that before, right? So if somebody's needing to burn that off to lose some weight, they kind of recommend cutting the calories about 500, is that right, a day to lose a pound, half a pound to a pound a week? Sound about right?
That sounds about right, and I wanted to reflect on where that came from. There is a recent published trial called the Look Ahead trial. This is a trial that led some of the changes that we have had in healthcare. The trial started back, it was published in the Journal of Obesity back in 2006. So if you count ahead, it's now about 6 or 7 years, and the data just came out in the beginning of 2012. And Lisa is right, that if we could learn how to cut our portions, start to read the labels, so that we can decrease our consumption per day by 500 calories, then we could, in essence, control our weight and have a positive impact on losing 5 to 15% of our body weight. Such a little amount, if you calculate that, and you only have to 5%, you multiply by 0.95, or 15%, you multiply by 0.85, and you will see how many pounds that you could lose by just decreasing your portion size. But what can we offer our patients who aren't as dedicated, who just doesn't have time, who have 4 kids, and a husband, a dog, and a bag of chips? I mean, for those group of people who just tell me what I need to do, this study has given us some reflection on what they can do. Well, the study is made up of about 60% children even, and it's also made up of adults, and it shows that if you could do a meal replacement as well as intensive behavioral training and coaching, that it could reflect to people staying or keeping their weight off 5, 6, 7 years. And that's what we really want to do. We want to stop the yo-yoing. We want to stop at the beginning of the year, you lose your weight, and then in the middle of the year, it's all back. So what can that study is telling us that if you go to your doctor, and you may start to see that in the beginning during this year, that the Center for Disease Medicare and Medicare now will reimburse physicians, and they highly recommend that you do intensive counseling and behavioral therapy for patients who have BMIs that are over 25 or the overweight, but more importantly, those that have BMIs over 30, that they will reimburse them for 2 visits during the month, 20-minute visits, and you're supposed to do that all during the year. That will total up of about $6 extra visits per year. So that if they have problems with working it into their schedule, if they have problems in knowing which exercise, intensive counseling, physicians are now supposed to really refer them to physical therapy, nutritionists, dietitians, to give them that extra boost that they need, because the data shows that if you do that over a sustained period of time, you can maintain that 5 to 15% weight loss. You could decrease that 500. And one of the things that it said, that it was self-control, that if they learned it early on, that it would be maintained and they don't have to keep going back to the doctor for it.
And I think this is, exactly what Heart of Memorial Health is, striving, really learning that responsibility, learning new behavior changes, and we have so many different options because everybody is different. You're going to lose the weight definitely
exactly.
At your own time, and learning, hopefully, healthy ways to do so by looking at what you're eating, making sure you are decreasing maybe those calories and increasing your exercise again to try to balance that out, to burn those calories. And we have a lot of different services that are actually available. We have dietary consultations that you can talk to your physician about and make sure that you go through that channel and look at a dietary consultation. We have bariatric, actually surgery, Marcia, which we have not talked about too, and then of course medical weight management. So really partnering with your physician to see what works best for you as far as your options. And Marcia, on that note, talk to us a little bit about some of the bariatric surgery options that we do have.
At Heart Memorial Hospital, we offer gastric banding. We do have other services that we can offer the patient, though, as far as our surgeon provides gastric sleeves and gastric bypass. We specifically, though, at Heart Memorial do gastric banding and have done it for about 3 years. Basically, what studies have shown is individuals have, before they reach the point where they would like to have the bariatric surgery, they have been through 27 different diets and failed, is what we have found. Now, one of the things that we really emphasize is moderation, changes in lifestyle. The surgery is just a tool. The individual still needs to utilize changes in their behavior, modification, exercise, behavior modifications, such as how can I learn if I have an emotional eating concern, if I eat because I'm upset? What can I do instead of eating? And those kind of things. And that affects individuals just in lifestyle. Before the surgery, individuals are exposed to stress, like Dr. Dowe talked about, living a high, fast-paced life, having 4 children, having a husband, doing all the things, working full-time. And those kind of things we take into consideration before the patient ever has surgery. We do try to attempt to help them learn changes so that they can have more positive outcome, whether they have the surgery or whether they do it in other ways.
Exactly, and I think what we've hit on is just really, again, everybody has to look at what's going on in their own life and what some of those triggers possibly are, and understanding that we're here with a lot of different resources to help you build those skills so that you can make that lifestyle change in an actual healthy way, because we all want to eat, and it should be something that's pleasurable, and it should be something that we enjoy, and then also making sure that we're doing some healthy things as far as our choices, and making sure that we're getting that time in our daily schedule too, that we can build in that exercise or something that's whether it be walking, and you have to do something again that you enjoy. Definitely, would you not agree, Lisa?
Yes. If you don't enjoy it, you won't keep it up.
It's not fun to take maybe an aerobic class if that's not your style, or to do rowing or to do this or that if it's not what you like to do. So you have to find what is your niche and enjoy it. And Dr. Dowe, like you said, you found that getting up every morning works best for you. So getting it into your schedule so that you can actually make the time to do it.
It's sort of schizophrenic in some ways, because we tell patients, lose weight, don't eat out, but Lisa spoke about it. We live in a obesogenic, you'll see that term in the literature, the obesogenic environment, because everywhere you look, it's food. So you come to the office and you say, don't eat this, don't eat that, 2,000 calories for a burning onion appetizer, and so forth. But then you go right outside the doctor's office and there it is. You don't have the conveniences of exercise. We don't have a lot of places you can walk that you really feel comfortable in walking. We're working on it. We're doing improvements along that line. We have some nice parks here in Hardin County that we can walk at, and sidewalks. But it is such an obesogenic that we really do. What about the patient that doesn't like to exercise? What about the patient that gets up in the middle of the night and just has to have a snack? Or individuals that use food for comfort? We should give them some tips and help them along during these holidays, because I see a number of patients in my office, and you want to know what can they do to help that.
Absolutely, and that's some of the things that we were talking about too, making those substitutions instead of the cookie, maybe having, what would we have, Lisa?
Well, you could modify the cookie recipe for one thing.
Go.
So, or fruit. Like I said, we don't eat enough fruit and vegetables, so using the substitutes there, and just looking at modifying, you know, the way that we cook. So you can still have the same taste, and that's just it. Like you said, we enjoy food, and it is a necessity. We have to have food to live, so it's not one of those addictions that you can just do away with. So learning to live with that, and that's the key to weight maintenance, is learning how to change those behaviors and to actually enjoy the food as well as the exercise.
You know, I think one of the things that I'm listening, you know, to our conversation, you have to actually be prepared, don't you?
Yes.
Because you have to be prepared for what you might encounter, what you might, your go-tos, what you might be able to eat. And then I'm hearing the other term too, you know, in shopping. We actually have to know what we need to purchase. But then also the moderation, that term moderation. It's not saying don't ever have the piece of cake, don't ever have the cookie. It's moderation and being able to have that control, which can be very difficult. Yes, go ahead, Marcia.
One thing when we're talking about this, if you get the patient involved, then it not only affects their health and makes it better, it also translates into their family. So it's not just the patient, it's the husband and the children. They become more healthy due to these changes in behavior and the moderation and those kind of things. So it's a long-term, a more global effect, I guess is the word.
What a great spillover for our society. We can maybe be healthier in the long run down the road. So as we wrap up, I really want to thank you for sharing this information. We've talked about a lot of different options as far as hopefully giving you an opportunity, our viewers, to maybe look at where you are with your lifestyle, your personal risk factors related to health. Maybe hop on that scale, see where you are. There's a lot of different websites out there, that can be very beneficial for you, as far as Lisa had talked about, the myplate.gov. The CDC website actually has, I think, a BMI calculator that you can put in your weight to calculate out maybe where you are. So hop on that scale. We challenge you to see where you are per your height, per your weight, and then open up that discussion with your healthcare provider about your personal risk factors and what you might be able to do to have a healthier life and a healthier quality of life too. With what's going on. So thank you again, guests, for being here today and sharing this great information with us. And again, if you need more information, we invite you to tune in to our website, which is www.hmh.net. Click on Health Link for a lot of different health issues and concerns or subject matters that might be important to you. And we hope you tune in next month for another important edition of Health in the Heartland.